So in this lecture, we're going to focus on the bacterial diseases that can affect the cardiovascular and lymphatic systems. So recall that the cardiovascular system is a closed system, and the blood travels throughout the body in order to transport dissolved gases, nutrients, metabolic wastes. And the liquid components of blood, we have a couple of different terms that we use. So plasma is the complete liquid part with all the dissolved proteins, nutrients, think clotting factors and antibodies. If we remove those clotting factors, that's what serum is. And so in the lab, when we do diagnostic tests, sometimes those clotting factors actually can interfere with the test, which is why some tests use plasma and some require serum. Recall that the other component of blood are the formed elements, which is just your white blood cells, red blood cells, and platelets. Recall that the heart is a double pump, and the right side is serving the lungs through the pulmonary circuit, and the left side is serving the rest of the body by way of the systemic circuit. And it's at the tissues where the capillaries are doing all of the delivery and pickup of those components that we just mentioned. And the lymphatic system is also a series of vessels that are going to start at the capillary bed. So any fluid that leaks out into the tissues can be picked up by the lymphatic system and put back into the cardiovascular system. Recall that it's not just about balancing fluids, it's also about picking up all those dissolved proteins that are usually produced by the liver, and the liver couldn't keep up if those proteins were constantly being lost to the tissues. And because the lymphatic system doesn't have a pump, it's fighting gravity, it's moving very slow. And so it's a very good place to put lymph nodes, which are going to serve to filter that fluid. And it gives a place for your white blood cells to sort of sit and wait for pathogens to come their way. So because the body is highly vascularized, we're going to see there are quite a few diseases that can affect the cardiovascular and lymphatic system. We can sometimes refer to these as systemic diseases. So let's start with septicemia. Primarily, we're talking about a microbial infection of the blood, and typically we're going to name this by way of which kind of organism. So if it's a virus, it would be called viremia, fungemia, or bacteremia, again, based on which kind of organism. So typically, these are going to be opportunistic infections, and Staphylococcus, because it covers every inch of the surface of the body, it's going to cover cause about 50% of the cases. The rest are going to be other opportunistic infections that come along. And gram-negative bacteria, primarily because of that endotoxin. So recall that endotoxin can trigger your innate immune system almost entirely simultaneously and cause shock. And so we're going to see most cases of sepsis, or many cases of sepsis, will be caused by gram-negative bacteria. So transmission is typically direct inoculation. So many times sepsis is associated with nosocomial infections because medical procedures are invasive. But anything that bypasses the skin, so think IV drug use, any kind of wound or insect bite. And so we're going to see quite a few organisms are transmitted through tick bites and mosquitoes and biting vectors. Typically, if you're immunocompetent, meaning you have a healthy immune system, you won't see septicemia in healthy patients because they're going to be what we call self-limited infections, meaning the lymph nodes are going to catch the organisms if they find their way into the blood. And so very oftentimes sepsis is associated with immunosuppression or other conditions. So signs and symptoms kind of depends on which organism it is, but typically fever, chills, nausea, the very vague symptoms. But septic shock can develop very rapidly depending on the organism that's involved. Because bones are highly vascular, osteomyelitis can occur when the bacteria find their way into those little nooks and crannies of the bone, which is incredibly painful. And typically petechiae, so petechial hemorrhaging, when you have these organisms affecting blood vessels at the very smallest level, so at the capillary level in the skin, you can usually see those petechiae developing. Because of the connection between the two vascular systems, when you have inflammation of the lymphatic vessels that run typically very superficially next to veins, if the organism finds its way into the lymphatic system, then we would call that lymphangitis. So very oftentimes those red streaks associated with inflamed lymphatic vessels are a good sign of septicemia, because the bacteria have found their way into the systemic system and will get caught up and inflame those lymphatic vessels. So a lot of people think that's actually a blood vessel that's inflamed, but it's really a lymphatic vessel that travels very superficially and parallels typically the venous system. Most organisms that can cause sepsis have a capsule, which means when they are encountering phagocytes, they are not recognized and not destroyed. And many of them also have the capacity to capture iron, which means fever is not going to be effective against them. Some of them are going to have enzymes that allow them to basically steal it from the proteins that our body normally uses to safely carry iron from the spleen, where it's being removed from old dead red blood cells, over to the bone marrow where it's needed to make new hemoglobin, and that protein is called ferritin. So some bacteria have the ability to sort of steal that iron in transit. Others just literally destroy red blood cells that they come in contact with, which again is a very rich source of iron. So recall that hemolysins are going to be a virulence factor that many of these bacteria carry. And again, we said gram-negative bacteria are very commonly the cause of sepsis, which means they are able to trigger your innate defenses and can lead to shock. So we've mentioned endotoxin quite a bit. Here's a pretty good summary table, since this is one of the most common virulence factors associated with sepsis. We'll talk about this a little more in detail here, so you can see that when gram-negative bacteria die in their outer membrane, that lipid A or lipopolysaccharide is released, and that will actually trigger some of your white blood cells to release cytokines. So this very first one on the far left, tumor necrosis factor, that is designed to be a very local message. When you have too much of that circulating in the body, it can trigger very high fever, and interleukin-1 also is a very powerful pyrogen. The other cascade of blood clotting factors can get triggered, and that can cause DIC, disseminated intravascular coagulation. That's basically where all your clotting factors are triggered at the same time and they get consumed. So recall, those are coming from the liver, and the liver can only produce so many at a time, which is why DIC leads to hemorrhaging. So we're going to see that with some of the viral infections in this chapter as well. And then complement. Recall that complement, some of those activated complement factor proteins can trigger inflammation. And inflammation causes vasodilation. So when you have all of these things happening at the same time, systemically as opposed to locally, that's what leads to shock. And so very high fever, DIC, and systemic inflammation are all very problematic in the body. So really we need prompt identification of the organism in order to give the proper antibiotics. So this is why we do a gram stain almost immediately. That's the first thing that we tend to do to make sure that we give the right kind of antibiotics. Typically you're going to have a source of infection. So if it's an infected wound, things like that, if you can deal with the source of the infection, you can at least limit the production of new bacteria. Because shock has a lot to do with leaky blood vessels and loss of blood pressure, then administering IV fluids can help counteract the shock. And of course, now we have antibodies against endotoxin and that tumor necrosis factor in severe cases of sepsis that can mitigate some of the tissue damage that's associated with it. So again, immediate treatment of any infection can help prevent sepsis, but otherwise, this is probably the most important thing you can do for the immunocompromised individuals to prevent that from progressing to sepsis. While signs and symptoms are typically diagnostic, blood cultures are not always effective. So in about fewer than half do we actually confirm the exact organism. And so we would call those occult septicemia. So the one localized infection we'll talk about for cardiovascular system is endocarditis, and about half the cases are caused by a bacteria that lives in the mouth called Viridans streptococci. Other normal microbes can cause this, and in many cases the pathogen never gets identified, and we would call that culture negative endocarditis. But the typical virulence factor here is an adhesant. So you've got to be able to make a biofilm on the valve of the heart to cause endocarditis. So immunocompromised individuals are much more likely, anyone who has an invasive medical procedure, and most importantly, those that have abnormal heart. So a heart murmur, a valve issue, those are the types of high risks. Also, patient history is really key because having a history of IV drug use is also highly correlated with this type of infection. Typically with endocarditis, you're going to have an obvious source of infection somewhere, and very oftentimes it's, for example, after dental surgery, because that's where this bacteria lives and it gets direct inoculation into the bloodstream through the invasive procedure. So signs and symptoms: fever, fatigue, malaise, and increased heart rate, which is tachycardia. Incubation period can be weeks to months, so sometimes it's hard to make the connection between the invasive procedure and this issue. And so again, if it is a heart or cardiovascular disease patient, very oftentimes they'll give them prophylactic antibiotics prior to dental surgery or even a thorough dental cleaning, which sometimes does draw blood. And treatment requires long-term antibiotics, and we'll see why it's associated with these things called vegetations, which oftentimes require surgical removal. So these vegetations are essentially, they start with a biofilm where the bacteria is essentially attached to the underside or the backside of these valves, and the bicuspid or the left atrioventricular valve is usually the primary target for these bacteria. And a vegetation is basically what happens when the immune system comes in and is trying to destroy the bacteria, but really can't destroy it, so it just walls it off. And these valves require a very flexible, healthy tissue to function properly. And so this is why these vegetations have to be physically or surgically removed. Sometimes it requires a valve replacement because of the severe damage that these vegetations can cause. Then we have a disease called brucellosis. It used to be called undulant fever or Beng's disease, and this is caused by a bacteria called the Brucella melitensis. Historically, they called it Brucella abortus because of its effect in livestock. And so the virulence factors here this is a bacteria that can get into macrophages and basically reproduce inside the phagocytes, which means the immune system will never see them because they're really not watching those cells, they're watching your tissue cells. This is a gram-negative bacteria, and of course endotoxin is one of its primary virulence factors. Signs and symptoms: it's again, the previous name undulant fever was associated with the fact that as these gram-negative bacteria die with each life cycle, essentially, they cause a really high spike in fever. And so that fluctuating fever is really one of the most obvious signs and symptoms. And it's basically each generation of bacteria, as they die, they flood the body with that endotoxin. So this is a zoonotic disease, and so the highest susceptibility are going to be those people who come in direct contact with the animals, so especially cattle and sheep and goats, and so ranchers, dairy workers, veterinarians. And so transmission can either be through the consumption of those dairy products, and because we rarely use raw dairy anymore. Ever since pasteurization became the norm, you don't see this disease very often, but there are still communities that drink raw milk, and so that's also a high risk. And anyone who's coming in direct contact with the animal and its fluids, so blood, urine, or even the placenta, if they're helping during the birthing process, can transmit this bacteria. And so how we prevent is, besides the pasteurization of the dairy products themselves, there is a vaccine for animals. So if we remove the source from the livestock, then that can reduce the transmission as well. So typically it's a mild infection in humans and usually doesn't require any treatment. Tularemia used to be called rabbit or tick fever, and this is caused by a bacteria called Francisella tularensis. This one is a zoonotic disease that requires a biting vector. So primarily we're talking about ticks. There have been a few cases that have been tied to deer flies, but a couple of different ticks. We have both the dog tick and the deer tick that can transmit tularemia. And so this bacteria is one of the smallest bacteria we know, and it's actually so small that it can cross intact skin. And so primarily it's transmitted either through the tick bite or just handling and consuming the contaminated meat or even water. In some cases it can be inhaled, and so that's one reason why the tularemia is one of the top 6 diseases considered for biological weapons, because it can easily be transmitted through the air. And there are a few cases here in the U.S. where individuals who were mowing and mowed right over an infected rabbit carcass then just raised the dust where that bacteria then became an inhaled pathogen. And so this is another bacteria that can grow inside of our white blood cells. And when the bacteria gets inside there, it will actually secrete something that keeps the lysosome from fusing with the phagosome, which is really the only tool that phagocyte has in order to destroy the bacteria that it just consumed. So signs and symptoms vary widely. It depends on how it's transmitted. Most commonly, it's again coming from tick bites, and so wherever the tick bite was, there'll be a fairly substantial lesion that forms, and you'll probably get the red streaks forming from that part of the body. And those symptoms can last for years. If it, on the other hand, gets in through the lungs, what we call pneumonic tularemia, then it can be fatal. So fairly short incubation period, a few days. Highest susceptibility, typically rabbit hunters, which is why it's historically called rabbit fever. But we know other mammals can carry it as well. It's just most prominent in rabbits. So typically anyone handling those animals. Because ticks are the most common transmission mode, avoiding ticks altogether or removing them promptly. What we're going to find with any tick-borne disease, it takes them about 36 to 48 hours to actually transmit any pathogen, because it takes them a while to sort of burrow their mouth parts into the skin deep enough to get to the capillaries, and then they have to actually regurgitate their saliva to keep the blood flowing, and that's typically when they transmit the organism, is after they've taken some blood meal and the body and the blood has started to clot. They have to regurgitate an enzyme to allow blood flow to start again, and that's when it gets transmitted. So using insect repellents to avoid those tick bites. If you're a rabbit hunter, washing your hands carefully after handling the carcasses, or wearing gloves to avoid contact in the first place. Cooking game thoroughly, especially again if it's rabbit. And fortunately, we do have effective antibiotics if it gets properly diagnosed. So most people don't even know about tularemia, and we live essentially here in Arkansas. We are in tularemia central. So the highest cases tend to be in Arkansas, Oklahoma, and Missouri. Some of the most recent data was from 2020, and you can see here there's quite a few cases reported in Arkansas. And then there's the plague. So this is caused by a bacteria called Yersinia pestis. And you can kind of think that species name pestis as in pests, as in rodents, which are one of the reservoirs. And this bacteria, number one, has adhesins, so they can stick to the body tissues. And they have a capsule, which is usually all that's required for your immune system to overlook them and not be able to destroy them. But then they also have what's called a plasminogen activator. And if you've taken AMP2 and you've learned about the clotting cascade, you know that this is a substance that our body produces to stimulate fibrinolysis, which is basically at the end of the clotting cascade. We don't want the clot to last forever. We want to break it down, and that's what fibrinolysis is. And so as plague bacteria get into the body, if they can basically break out of a clot, it allows them to then disseminate through the body. And so that's really what they're doing. They have sort of a built-in enzyme to do that. So there are multiple forms. What we call bubonic plague is the type that's typically transmitted through the bite of an infected flea from the rodent or reservoirs. And so what happens actually is because the organism causes, remember it has adhesins, the bacteria gets into the esophagus of the flea and basically grows to the point where it blocks the esophagus completely. And so as the flea is jumping around looking for a host, it's feeding, it's biting, and it's trying to feed, but nothing's actually going into the stomach. And so it's basically starving to death. And that basically triggers it to jump from host to host to host. And that basically then the bacteria is being regurgitated with each bite. And that really is why crowded conditions that have fleas present is going to be the highest risk for spreading that bubonic plague. Pneumonic plague, on the other hand, if it gets to the respiratory system, can literally be directly transmitted through respiratory droplets from person to person. Septicemic plague is what happens when you have contact with infected fluids or tissues. In fact, there have been cases where blood transfusions transmitted the bacteria. And so recall that this Yersinia pestis is a cycrotolerant bacteria, which means it can survive in the refrigerator temperatures, which is where we store blood products. So this is one reason why it's important for screening blood products. So prevention, of course, getting rid of the vectors to start with, but rodent control as well, because they are the reservoirs where the fleas get the bacteria in the first place. Wearing gloves when handling and butchering game. So if you have certain species like for example, nutria, which is a rodent in the southern states that is sometimes butchered for meat. That's one place that this can be transmitted. And there is a vaccine, but it is not something we routinely give to everyone. We typically limit it to very high-risk personnel, such as those working in a lab that is doing the diagnostics, or military personnel, because this is another organism that has been of concern for being developed as a biological weapon. And of course, veterinarians who might come in contact with infected animals as well. So again, rodents are the natural reservoirs for this. And so we tend to think of plague as an ancient disease, but we still have natural reservoirs, even in the southwestern U.S. This is a disease that is sometimes currently diagnosed. And many times it's from things like groundhogs. So if you have a groundhog that on your property and you have a pet, then the flea comes from the groundhog to your pet and then to you. But again, if the organism can get into the lungs, then it can be direct airborne or respiratory droplet transmission. So symptoms, it varies again depending on which form you have. So within a couple of days to a week, you can have bubonic plague. And it's named bubonic plague because when the bacteria gets caught up in the lymph nodes, they become very swollen and inflamed. And that's where the word bubo comes into play. Now, typically, this picture is showing one in the armpit, but a bubo was historically defined as an inguinal lymph node. So if you got the inguinal version of an inflamed lymph node, that was typically called a bubo. And because lymph nodes, if they are inflamed, they'll block the transfer of fluids back to the cardiovascular system. And so because, again, the connection between lymphatics and blood vessels, then that bacteria can get into the systemic blood vascular system, and everything downstream from that blocked lymph node then loses blood flow, and those tissues can become necrotic and gangrenous. And so very oftentimes the bubonic plague was also called the black plague because those tissues became black with necrosis. Recall that the pneumonic plague, because it can be spread through respiratory droplets, those symptoms can actually progress within hours. And typically, when we think of the plague, running through populations, that we've had 3 major pandemics of the plague, which killed millions of people. It was typically in the pneumonic form because it would very rapidly be passed from person to person and is the highly fatal form. So diagnostics pretty much depends on the symptoms, and the treatment really needs to be started immediately, especially if it's the pneumonic form. And so we do have effective antibiotics if it is properly diagnosed, and even with treatment, we still have potential high mortality rates. And so without treatment, you'd have about a 15% mortality rate with bubonic. Septicemic plague could be about 50% mortality rate, and without treatment, pneumonic plague was 100% fatal. So you can see here it's really the southwest or the western part of the U.S. where this is endemic, but we do still see plague in other parts of the world, especially where we have poor rodent control and crowded conditions. And then there's Lyme disease. This disease was named after the city, Lyme, Connecticut, where a pediatrician back in the 1970s noticed some of his patients were all being diagnosed with arthritis, which, as everyone knows, arthritis is a disease of the elderly, not children. And so it was an unusual thing to see. And so this is, again, a spirochete bacteria called Borrelia burgdorferi. And these are gram-negative, so we're going to see endotoxin is another problem here. Also tick-borne, so this one is spread through the nymph stage typically. So recall we have the larval stage, the nymph stage, and the adult stage. And typically the nymphs are very small and easy to overlook. Now the larval stage aren't actually infected yet, so they can't. So what sometimes people call seed ticks, right? They're basically the freshly hatched from the egg stage. They are not going to be infected with anything. But the nymph stage, it's when that seed tick or that larval tick has gone and fed on a host that it picks up the bacteria. Adult ticks are much larger and typically easier to see, so most people don't overlook adult ticks, but the nymph stage is really difficult to see. And so this bacteria can reside in both rodents and deer. Most people think deer, but it's really the rodent stage that seed or larval tick picks up the bacteria and then it passes it along. So if you look closely, an adult tick has 8 legs. the uninfected larval stage has 6 legs, and so when it goes into the nymph stage, it'll go to that 8-legged stage. So most people don't take the time to count the legs on their ticks, but again, it's that's one way you know. If you get a 6-legged tick off of your body, it won't carry any potential pathogens, but that nymph stage is really the difficult one to see and the most likely to transmit bacteria, in this case the Lyme disease bacteria. So the virulence factors are going to vary here. So recall that the function of fever is to lock up or sequester iron so that bacteria can't use it to replicate. These bacteria, however, don't use iron. They use manganese as one of their cofactors for the electron transport chain. So fever is completely ineffective. You will have fever with Lyme disease, but it's not going to be effective against that bacteria. The other problem is antigenic shifts. So every time this bacteria replicates in your body, it looks different. And so again, your immune system can't see that. That's also why we don't have effective vaccines against Lyme disease, because the bacteria looks different with each life stage or each generation. And again, it is a gram-negative bacteria, so that endotoxin is also problematic. Diagnosis is only really effective when it's very early on, and so and the early signs are fairly vague and difficult to pin down, especially if you don't know you've had a tick bite. If you've had a tick bite, then it becomes pretty obvious. Most people think Lyme disease is guaranteed to show the what they call the bullseye rash or erythema migrans, except only about 80% of cases will have this rash, and it varies widely. So sometimes it gets misdiagnosed as ringworm because of the way that it's raised in a singular circle. It typically starts at a central point and then migrates out, which is how it gets the name. But it doesn't always look the same, and not everyone will get the rash. So unless you know you've had a tick bite and you go in for a tick panel, only antibody tests can actually confirm it. They rarely actually culture the bacteria in the blood. If the disease has progressed, it's really difficult to diagnose because Lyme disease is just one of many spirochete diseases that are transmitted via tick bite. And so if you're in the very later stages, the symptoms are going to mimic arthritis or other conditions. So heart palpitations, numbness in the hands and feet is not something that you would tie to a tick bite years earlier. And so when they do the tick panel, all they can say is that you've been exposed to a spirochete, but they can't actually confirm the disease much later in the progression. So prevention, just like any other tick-borne disease, avoiding tick bites. So typically we think of DEET as the most effective anti-tick insect repellent. And again, removing ticks as soon as you can prevent them from getting to the 36 to 48 hour window where they're going to regurgitate and pass on any pathogens in the first place. So if you go outdoors, use protective clothing. There was a vaccine that actually was on the market, but it got removed in 2002, partly because it was inducing disease in the individuals in the clinical trial. And so now they've been looking to use a monoclonal antibody treatment, which will basically be used as a prophylactic treatment during tick season in places where this disease is very high incidence. And so again, early treatment is most important. So antibiotics can be used early in the progression of disease, but once it becomes those later stages where your symptoms are essentially arthritis, once the damage to the joints has happened, it's really difficult to treat. So you can see when we think of Lyme disease, typically it's of the northeast, and so this is one of the most common commonly reported vector-borne diseases. And even though we do have it in Arkansas, it really is a big problem. So again, it's named after Lyme, Connecticut, which you can see in the Northeast. And so here in the Southeast, we don't think much about deer populations because hunting is sort of a tradition. But in the North and Northeast states, hunting is really not that common. And so most of the deer population control is actually done by the state agencies, where they have to cull the populations to keep them in check, and primarily to keep them to keep the number of car accidents to a minimum, because there are so many deer that they cause a lot of car accidents. But you can see the number of cases of Lyme disease has steadily increased over the decades, and partly the CDC blames this on two things. Number one, more humans need more homes, and so we continuously are moving into more wooded areas and taking away their habitat. But also the fact that most people don't realize deer had been overhunted to the point where they were nearly extinct in this country before they put in hunting regulations. And so hunting regulations have been so effective that the deer population has also increased over the past decade. So again, in some parts of the world or some parts of the country, hunting really does keep them in check. But in other parts, because the population is so high and there aren't any hunters, they actually have to go out and cull those populations to keep them in check. So this bacteria is found worldwide, and we do have the vectors everywhere. So we tend to think of this as a disease primarily of North America and parts of Europe, but you can see it does exist pretty much everywhere. And we've got a couple of tick-borne diseases that have got lumped together because really they're almost identical with exception of the pathogen. So what's called ehrlichiosis or anaplasmosis are caused by bacteria. The Ehrlichia chaffiensis, that actually was named for Fort Chaffee here in Arkansas. Anaplasma phagocytophilum is the other organism, but both of these are transmitted by ticks from reservoirs, which include cats and dogs. In fact, the dog breed that is most likely affected negatively by these infections are German Shepherds. In fact, it can be fatal in that particular dog breed. And they have documented a few cases of blood transfusion of these bacteria as well as organ transplants, but that's fairly rare. So early signs and symptoms are very much flu-like, just fatigue, fever, headache, those types of things. So it's sometimes hard to diagnose. If it goes untreated or treatment is delayed, it can be a serious infection, especially in immunocompromised individuals, and it can be fatal. So just like other tick-borne diseases, getting rid of the tick before it can transmit is important, or avoiding them altogether, and especially because this is something that affects animals, your pets. Make sure that you check them for ticks regularly as well, or treat them to prevent ticks. So there are no effective vaccines available yet, although they have been working on a dog vaccine for quite some time. This was actually one of those things that we consider an emerging disease because it was completely unknown prior to 1987. So if it gets diagnosed properly, antibiotics can be effective. Unfortunately, some of the most effective antibiotics include tetracyclines and those in the family of tetracycline. And historically, that is something that we didn't like to prescribe to very young children because it had the risk of permanent tooth staining. And so doxycycline is now the preferred antibiotic for this. And because children under the age of 10 have a much higher fatality rate, it's really important that they don't withhold that treatment. And so the newer tetracyclines, like doxycycline, doesn't have near the risk of tooth staining as the older class of those drugs, and so it should not be withheld because it can be a dangerous infection for very young patients. So one of the virulence factors for these bacteria are the fact that they can actually get inside of phagocytes. And so we've talked about a couple of these diseases already in this lecture that they are intracellular pathogens. And so typically when we think of intracellular pathogens, we think of viruses. So there are very few bacteria that can actually do this. But when they do, they basically can hide away from the immune system if they're living inside of a phagocyte. And all they have to do is keep that lysosome from fusing with the phagosome, because that's really the only weapon that a phagocyte has. So historically, this, when they first described this, they called it the human monocytic ehrlichiosis. But typically, we just call it either ehrlichiosis or anaplasmosis if it's the other bacteria. So again, diagnosis can sometimes be difficult because they start out with mild flu-like symptoms. But in unexplained acute fever, if you're in any area where there's ticks, if it's the season for active tick bites potentially, it should be considered, especially in very young patients, because it, again, can be a fatal disease in some individuals. Very young and very old patients are typically the highest risk. Then we have Rocky Mountain spotted fever, and this is caused by a bacteria called Rickettsia. And this is named after the gentleman who described it. His last name was Ricketts. Not to be confused with the disease called rickets, which is a complete lack of vitamin D in bone development. But this is also a tick-borne disease, and this can come from reservoirs that, again, include either dogs or rodents, typically. And the rash that's associated with this tick-borne disease is typically non-itchy, and it's going to happen on the trunk and the appendages. And what's very unusual is getting a rash on the palms of the hands and feet. So that's not a usual place that rashes occur because that skin is much thicker. In severe cases, if it goes untreated, this can actually cause organ failure, so especially in the kidneys and the liver. So again, just like some of these other diseases we've been talking about, these guys can live inside of the cell of the phagocytes and prevent being destroyed. So it's not really clear how it does damage, but all of the rash that you see is basically damage to blood vessels, so think capillaries in the skin. So again, because it's tick-borne, avoiding ticks or removing them promptly and treating immediately with the proper antibiotics. So getting diagnosed is key. So even with treatment, this one has about a 5% mortality rate, and without treatment is typically fatal, and again because of organ failure. So you can see here it's kind of unusual that they named it Rocky Mountain spotted fever, because it's much more common in the Smoky Mountains than it is in the Rocky Mountains, but it was discovered in the Rocky Mountains, so that's how they named it that way. Cat scratch disease, or sometimes called cat scratch fever, also caused by a gram-negative bacteria called Bartonella hensleyi. And this one, again, gram-negative bacteria all produce endotoxin, so that's its primary virulence factor. And just like the name suggests, cat bites or scratches, and typically it's coming from very young cats that, number one, don't have very good hygiene and are a lot more playful and more likely to scratch and bite. But even fleas can pick it up from a cat and then transmit it that way. So typically it's not just contact directly with the cat. And so the diagnosis really depends on having a known exposure to a cat. And so where the scratch happens, typically the bacteria will find its way to the nearest lymph node and will cause inflammation. And again, some general symptoms like fever and malaise. And so typically if you have an enlarged lymph node, if it's an infection, typically it's very painful. Painless enlarged lymph nodes is sometimes a concern for cancer. So that's why knowing that you've had an exposure to a cat can save a lot of unnecessary tests looking for cancer when it's really just a bacterial disease. But these inflamed lymph nodes can last for months, so that's another reason why it sometimes gets concerned that it's cancer. But there is a serological test that can confirm, and preventing it really just proper cleansing of wounds, especially if they've come from contact with a cat. And proper diagnosis can be treated with antibiotics. Then we have a disease called Q fever, and this is another one that's kind of considered an old disease, but is still very much a possibility. This is a gram-negative bacteria, Coxiella burnetii. And this one is typically, again, it's a zoonosis, so it comes from contact with infected animals. And typically, it's coming through inhalation. And so if you are working in a barn where animals have given birth and there are dried placenta or urine, any kind of animal secretions in the dust in that barn, it can be inhaled when you're sweeping or cleaning the barn. And so typically it comes from goats. So it used to be called goat fever, but it can be carried by other livestock. And so again, this is one of those bacteria can get inside of monocytes, which is one of your white blood cells or macrophages. And if it lives inside of those cells, then they can't be destroyed. And so this particular gram-negative bacteria also has endotoxin, but it has a very unique chemical form of that LPS, lipopolysaccharide, in its outer membrane. But it functions like your typical endotoxin. So in humans, about 60% of cases, most cases, are completely asymptomatic. And you might have some flu-like symptoms in mild infections. In some people, it becomes a chronic infection and can be fatal. And so again, it just really depends on how your immune system responds, what your underlying health conditions are. And if a pregnant woman is exposed to these bacteria, it increases the risk for miscarriage. So that's typically where we worry most, is with pregnant women. In animals, this is one of those diseases that actually doesn't have any symptoms other than if it's a pregnant livestock, then it can cause abortion. So getting proper diagnosis is really important and typically requires a combination of antibiotics long term to prevent it from becoming that chronic infection in some individuals. So again, prevention, just avoiding contact with animals and their birth products, or taking caution when you have to be in contact. Because it can be transmitted through dairy products, pasteurization again has really reduced the amount of transmission, but avoid consuming raw milk. If you have a heart valve or other cardiovascular disease, history of other cardiovascular diseases, then those are higher risk individuals, or immunocompromised individuals as well have a higher risk. And of course, pregnant women have the highest risk associated with that low birth weight or potentially miscarriage.